Hi everybody, welcome to the Stoic Mindfulness and Resilience Training Week 4 final live webinar while I switch off my mobile phone. And it's hello from me, Donald Robertson in Nova Scotia once again. If you want to just take a moment to introduce yourself in the live chat section on the right hand side of your screen and say where you're from, that would be great. And let me just do a quick introduction to what we're going to be doing today. So, I should say a little bit about the agenda and so on. So basically we're going to do some introductions, a little bit of housekeeping, a little bit of news, and then the main part of the webinar will begin with me giving an overview of week 4 and responding to the comments that you've already posted online, and hopefully also any questions or comments that you put in the live chat area. So you can think of questions now that you want to post, and there's a 30-second delay on the video, so I won't see questions immediately, but I'll try to check in with your comments periodically and respond to them. And in particular, at the end of the session today, I'll have a look through, and if I can pick out any questions, then I'll try to answer those. So if you do have questions, actually, I tend to spot them more easily if you post them towards the end of the webinar. So the session should last roughly 30 to 45 minutes today, but it will be recorded so you can replay it later anytime if you missed part of it. Just via the same YouTube link. The live chat comments aren't saved, but you'll be able to post new comments underneath the YouTube video once it goes up as a permanent recording. And I should say I'm reading your comments and so on my notes periodically, so I might look away from the camera. Apologies for that. Mookie Dog is here. I don't know if she's on camera or not. I think just about. You might be able to see her ears or something, so she might bark or wander about in the background today. And also I should check that you are all receiving audio okay. Looks like it. You're introducing yourselves and stuff, so I guess you can hear and see me okay. Cool. So let's kind of get into the content a little bit. Some statistics. First one hasn't changed. We have 1,853 people doing Stoic Mindfulness and Resilience training this year. The first webinar that went up for week 1 has now been viewed 3,800 times. So let's say there's a lot of people that view it live, and then there are a lot more people that view it afterwards. Last week we had 152 concurrent viewers for the webinar, which is down a little bit. You always expect a kind of a decrease in the number of people over the span of an online course. It was 192, I think, previously. So it went down a little bit. We had 201 live chat messages, and over the past week 1,250 people have viewed last week's webinar. So week 4 is now available online. You can just go to the course and read the contents now, and I'll try to post a direct link in the comments area after we finish in case you need help finding it. And I'll be, like I said, I'll be going through some of the questions that people have therefore already posted in that part of the course. Cool. So overview of this part of the course. As always, it builds on the preceding weeks, basically, and the emphasis in this part of the course, because this is a resilience training course, maintaining long-term improvements is very important. So this part of the course is about maintaining skills and improvements, and therefore building up a more general sense of stoic resilience. It's about permanent or lasting change, in other words. So the sections are, the lesson this week focuses on relapse prevention or general resilience building, how to strengthen your mindfulness techniques in advance of facing a broad range of potential future setbacks. This is integral to Stoicism anyway, and in modern cognitive behavioural skills training, part of the process may often be that we anticipate possible setbacks in the future, high risk situations, or potential adversity that we'd want to prepare coping with. And so the lesson really is talking about that concept in Stoicism, the concept of premeditation of adversity, or as William Irving calls it, negative visualization. And also it talks about this idea that when we're mentally rehearsing future events, there are actually, it's just one of those oddities really, that I'm a kind of techniques guy in therapy, and one of those oddities that I've spotted over the years is when you get people to visualize future events, they kind of often assume that there's one technique or there's one way of doing it, and in fact that's the basis, or it's the format of a whole bunch of fundamentally different psychological techniques that work by means of different psychological mechanisms. And so that these things often get conflated, and that leads to a lot of confusion, because depending on what your goals are when you're visualizing future events, you're going to do it differently. So that's something I'm going to return to a little bit later. This is an area where the Stoics don't give us a lot of detailed information actually. There's kind of hints that they understood some of the more technical aspects of what they were doing, but we would do well to look at cognitive behavioural therapy and the stuff that we can learn from research there about mental visualization techniques and the way that they work, the do's and don'ts, the hints and tips and so on. The lesson this week talks about the difference between, for example, practicing detached mindfulness while you're using imaginal exposure or imagining a future event. So we can picture something challenging or distressing happening in the future while rehearsing an attitude of mindfulness. And we've also looked at valued living and values clarification. So another use of this technique is to picture events in the future and mentally rehearse behaving differently or coping differently in those situations by acting in accord with our values. And the exercise that we have for this week, Mickey's chewing her paw or a bone or something there. The exercise we have for this week is different from the ones that we did before, because they were more single session seated meditation type techniques, and the version that you're going to do this week is what's sometimes called a rapid frequent approach to using a psychological skill. So the idea there is to prevent compartmentalization. Okay, so when people practice a relaxation technique or visualization technique, for example, like I've met many people over the years who told me, for instance, that they were really good at relaxing in a yoga class, and then afterwards they go to work and there's someone that bugs them that they work with, and they just get really tense and lose their temper with them. So they've got really well developed relaxation skills, let's say, but they're totally compartmentalized. Like they don't transfer or generalize, as we would put it, to different situations. So they've kind of done half of the solution really well, but there's a bit that they've completely missed out, which is transferring that skill to other situations. And I guess I should say, so just some general therapy observations about this that are very relevant to Stoicism. If you learn a skill like relaxation, mindfulness, whatever, there are several ways that you can get it to transfer to different situations. One of them is to repeatedly put yourself in the challenging situation while practicing the skill in reality, and that's usually made easier if you can abbreviate the skill to make it much more accessible to you. So if you can learn to relax really quickly rather than doing a 10-15 minute muscle relaxation, if you can get to the point where you can use, say, a trigger word to yourself or something and recapture at least some of that, then it might be easier for you to actually practice it in a number of challenging situations. And another way that you can do that is just by practicing it all the time, or practicing it very frequently throughout the day. So you could say, I'm going to practice like a couple of minutes of very deep mindfulness or relaxation every time I look at my computer, every time I enter or leave a room, or just set an alarm and say you're going to do it every hour throughout the day, so that the skill kind of spreads throughout your day and it becomes more of your general attitude throughout the day. And the other way of transferring skills to other real-world situations, a wider range of real-world situations, is just by visualizing them, like we mentioned earlier, that the Stoics do that in the technique we call Premeditation malorum, or the premeditation of adversity, or negative visualization. So actually, and you could be in your bedroom relaxing very deeply and visualize yourself jumping out of an airplane or whatever, something that's stressful, and transferring those feelings of relaxation in anticipation to the pictured event. Occasionally you'll get people who go, well, I don't really see how that would work, because if you're just visualizing it, you're not there in reality. Well, like, there's tons of research that show that it works very reliably. It's the basis of a great deal of clinical practice in CBT and other therapies. There are occasionally you'll find that it doesn't work, but usually there's a reason for that, and you can identify that and deal with it. But essentially, when people visualize situations and change the way they respond to them, they tend to respond differently when they find themselves in the real situation, as long as they've done it in the right way and they've done it like sufficiently, like they've repeated it enough, for example. So you're going to be doing a rapid, frequent mindfulness exercise, hi Mickey, throughout the day. And we left some flexibility about the way that you would do that, actually. I gave you some examples, but also suggested, because we find people at this stage in the course tend to be doing their own thing to some extent anyway. The audio recording for this week is, let me just check, that doesn't look right. I'm pretty sure the audio recording for this week, is the imaginal exposure with mindfulness exercise, not what I had written in my notes. And that is, it's about 15 minutes long, so it's a little bit longer maybe than some of the other recordings. It's more of a psychological skill, so it requires more effort. It requires more forethought and planning and preparation. So we've gone from doing stuff that's kind of a little bit more passive to doing stuff where you're going to have to like really take ownership of the exercise and think about how you can make it work for you. Like these kind of exercises, it basically is the difference between doing something that you can just sit and absorb passively, like listening to a script, and doing an exercise where you are now actively responsible. Like you've been put on a bicycle and asked to ride it. You're gonna have to turn the pedals. You're gonna have to kind of engage in some trial and error learning if you're going to get this process to work for you. And it's about as reliable as a bicycle, actually. It's one of the most robust types of psychological skills that we use in therapy. But you're going to have to balance and turn the pedals to get it to work for you. You'll be rehearsing future events, setbacks, and so on. We'll talk a little bit more about that. The main thing I should say is, in therapy, we would actually sometimes get clients to picture like the worst thing they can possibly imagine. That's called flooding. If they're in a place where they're able to do that, it can be very effective in a very short space of time, especially if they're coached and doing it in the right sort of way. I wouldn't advise doing that at home without supervision in this kind of exercise. It's hard to give general advice because one person's worst case scenario might be mildly disturbing, whereas for another person it might be completely traumatic. So basically, don't pick something that seems like it might potentially be overwhelming with you. You need to be the judge yourself of whether you're biting off more than you can chew when you're mentally rehearsing things. So there'll be some people who can picture almost anything and it's not really that much of a challenge to them, whereas there'll be other people who are more sensitive and more easily overwhelmed by their feelings, especially people who are prone to panic attacks, for example. They may find that their anxiety escalates very quickly. So That's why we suggest that people don't do these exercises if they have a history of mental health problems, unless it's under the supervision of a therapist and they can give them advice on how to do it appropriately. But for general purpose use, yes, it's absolutely fine to picture, as the Stoics did, distressing events in the future and wait for your anxiety to abate naturally. So the other key thing I'd say here is when you're doing imaginal exposure, if what you're going for is habituation, which is anxiety reduction, one of the most robust processes and most robustly established processes in the entire field of psychotherapy research, and what the Stoics don't tell you and what we need to know about it is it takes a certain amount of time to happen. So it might be 5, 10, 15 minutes typically, where people are picturing something they have a phobia for example, before their anxiety reduces by at least 50%, at which point they might end the exercise and then they go back and do that repeatedly. But if somebody is anxious about a situation and they picture it for 30 seconds and their anxiety spikes and then they stop, that's probably not going to help them, and in some cases it may even just make them feel even more anxious. So the key factor, the main factor, is the duration of the exposure. Forgive me if I've told you this story before, but it's the easiest way to explain anxiety habituation. Imagine you have someone who has a cat phobia, and it's one of the simplest forms of anxiety, and you put them in a room full of cats, right? So let's say we use a heart rate as a measure of anxiety, which actually is a fairly good measure of anxiety. So what's going to happen to the heart rate when they see all the cats and they're in a room with them? It's going to spike. Like within about 10-15 seconds or so, it's going to approximately double. So it'll go shoot up from like 70 to about 140 beats per minute if they're really, really anxious. Then what happens? It's a magic question. I've asked hundreds of clients in therapy, and usually people who suffer from anxiety have a kind of slightly nonplussed look when you ask them that question. I think because they're kind of conflicted. They sort of want to say, well, I guess it's going to have to go down. Like that's obviously in a way that's the only answer. However, when people are very anxious, they kind of are hesitant to say that. They sort of don't want to say that because it seems too simple. But yeah, their anxiety will go back down again. So if the heart rate goes up, it's going to gradually reduce. Then the more kind of meaty question is, well, how long would that take? And the answer is it would maybe take anything from like 10 minutes to half an hour. It's going to vary depending on the individual type of anxiety, the severity of it, and a number of other factors. So if it's as easy as that, like what will tend to happen is the anxiety will reduce. Then what would happen if you put them in the same situation again? Their anxiety will go up, but not as high as it was before, and it will reduce more rapidly, and so on and so on and so on. And then you get what I call like a stegosaurus's tail effect over time, and that's how anxiety treatment typically works. So that's the basis of it in a lot of therapy. When the Stoics are doing premeditation of adversity, I think they're aware of this mechanism. Certainly some ancient authors refer to it. Plutarch, although not a Stoic, refers quite explicitly to the idea of anxiety wearing off or abating naturally through exposure. I think the Stoics realise that as well. So many people when they're reading books about Stoicism will just visualise things briefly, and then maybe they're just doing it in a very ineffective way. They don't realise that what makes that technique work is the duration. It's important because most people, you could say if it's that easy, why do more people not overcome their anxieties naturally? And the answer is because we have a very, very strong aversion to a desire to avoid or aversion to the things that make us anxious, and that peaks not even at the point at which our anxiety is highest, but before that. So people will have a very, very, if you tell someone you're going to put them in a room full of cats, they're going to have a really strong urge just to run away before you even open the door. And you know, people have an aversion to thinking about these things. They don't like doing it for a long time. Even if they do it for a long time, often there's a feeling of kind of boredom that kicks in, and so people stop doing the exercise at that point. And then you might say, well, how does anybody ever actually do these exercises? And the answer is, if there's someone else with them coaching them through it. That's the main reason that people will normally stay in the room with the cats or continue to visualize the blood of the cats or whatever it is that makes them feel anxious. So someone else is encouraging them to do it. But we don't have that luxury when we're doing these kind of self-help techniques. It requires more self-discipline to make ourselves patiently and systematically do things that would normally require the presence of a coach or a therapist. The behaviour therapists who first introduced these kind of techniques pointed out, though, that this is how anxiety is overcome in daily life. If you have a child and they're frightened of getting in the ocean and swimming, then as a parent, what you do is gradually just encouraging them to keep putting their foot in the water and going in a little bit deeper until they get used to it and the anxiety wears off. There's even a story about this in Aesop's Fables, the story of the fox and the lion, incidentally. The moral of the story is that by repeatedly putting himself in the threatening situation day after day, the fox gradually becomes less afraid. So that is a lightning guide to how imaginal exposure works. There are some things there that people typically misunderstand or get wrong, so it's important to think about. I think in the exercise we also asked you to use a thing called a SUD scale, which is a subjective rating of how anxious you feel. So like from 0 to 100%, I feel 70% anxious at the moment. Obviously, some people will say, well, I can't measure it accurately. No, like it's a very rough subjective measure, but it allows you to do a relative measurement. So I know if I arbitrarily say, I picture a load of blood and stuff and I have a 70%, I call that 70% anxiety. And then I do it again tomorrow and it's not as anxiety provoking. I might say, okay, well, relatively speaking, I could call that 60% now or 50%. So it's not an objectively valid scale, it's a subjective scale, but that's all we need in order to measure our own progress when we're using these exercises. And there's some reason to believe that even the very fact of using the scale contributes to the process. I guess we talked before about distancing, and putting a rating on feelings of discomfort or anxiety helps us to view them like a scientist, if you like taking a step back and objectifying our feelings a little bit. Rather than just being swept along with them. So it gives us a degree of cognitive distance, or can contribute to that anyway. The self-monitoring exercise this week again is also different. It's really more about taking the previous self-monitoring and turning it into what we call a blueprint in therapy, which is like a little written plan that crops up in many different varieties and many different forms of therapy. And it's basically a way of planning out what you think your main triggers are that you're going to face in the future, what high-risk situations are problematic for you, what early warning signs you typically spot within yourself, what do you expect are the problematic thoughts, feelings and actions that you normally have, what could you voluntarily do instead, like that might take things in a different direction. So it's really just kind of thinking about what are the key situations where problems happen and what you would like to be doing instead, and writing that down as a kind of plan of action, something that you can refer back to. The discussion questions today, let me just check in with you folks briefly before I get on to the discussion questions and see if you've posted any questions in the chat area. Yeah, and orchestrating the deaths of millions and millions of people. How did we get onto that? Like, some of the live chat discussions look like that you guys are having a totally parallel conversation. I'm pretty sure that's not. Is that related to phobia treatment? Probably not. No. Stalin. Okay, how did Stalin come into this? All right, let's get back to the program then. Audio recordings. The comments that people had posted on those. So there are some really good comments that have already appeared actually. So I'd advise you as always to go back and have a look at the things that people have posted. So Nazim asked a couple of really good questions about premeditation of adversity, or what therapists would call imaginal exposure, mental rehearsal. And he asked whether it's better to do it in a third or first person perspective. I've been teaching visualization techniques for like a long time, 20 years, over 20 years. And that's one of the most common questions that people ask. I kind of forgotten about it actually when we were doing this. Maybe I should have added some notes on it. There are, like everything in life, there are pros and cons to doing it either way. For this type of exercise, generally speaking, I'd say do it in a first person perspective. If your aim is to overcome feelings of distress or anxiety, and you want to transfer that to real situations, you want to basically make the thing you're visualizing as close as possible to the real world situation. And a big part of that would be making it a first person perspective, so seeing what you would actually see in the real situation. You can easily reduce anxiety by picturing things from a third person perspective, but it's kind of cheating, because most people then find that when they're in the real situation, anxiety comes back. Not always, but generally, like, it's not as effective as a means of generalizing, transferring the change to the real situation. So normally you want to make it as realistic as possible, or in more technical terms, expose yourself to all of the anxiety cues, and that would mean doing it in a first person perspective. Where a third person perspective, like seeing yourself from the outside, comes in useful, and I'd suggest doing this maybe later, that's very useful for rehearsing changes to behaviour, because you can see what you're doing and the way that you're doing it in a way that you can't from a first person perspective, like if you're watching yourself on CCTV or something. So in a third person perspective, you can picture yourself doing problem solving, or it would be good for imagining yourself exhibiting assertiveness in a variety of different situations and thinking about what you're saying and doing and how it would come across if seen from the outside. So say someone has social anxiety, they'd normally picture things from a first person perspective until the anxiety abates, and then they might picture it from the outside, possibly, and imagine rehearsing a number of different assertiveness strategies, things that they might say and do. So where that would come into the Stoicism would be maybe picturing yourself from a third person perspective, acting in accord with your core values for the sake of valued living. But that normally you deal with anxiety or other distressing feelings first, and that's usually best done from a first person perspective. Nazim also said something about imagining yourself kind of going back and re-scripting, I think, or changing conversations in the past. You can certainly use exposure to events in the past that evoke disturbance. Again, it is useful sometimes to replay them and change the way you respond, but the most reliable technique generally in therapy is exposure therapy and anxiety habituation, and that's normally best done by picturing things more or less as they were until you get bored with them and the feelings wear off. And again, then I'd normally then move on to re-scripting the conversation and changing it. There's some exceptions to that in different types of therapy, but for general purposes, for resilience building and stuff, I normally deal with the feelings first, and so I'd keep things verbatim until the feelings have abated, and then start changing the content, basically. But to some extent also you need to decide these things on an individual basis. It depends on the nature of the situation. Also, in relation to that recording, Daniel had said that he'd found accepting the worst case scenario helped him to realise it wasn't so bad, and also then to think about different ways of coping. That's a different mechanism, but it often, like I said, there are all these different mechanisms that kick in when you do exposure or visualise things. That's more of a cognitive mechanism, and it's basically what we tend to call decatastrophizing in therapy, and it's part of Stoicism as well. The Stoics want to learn to view things as being indifferent, and they also want to think about how the sage would cope. They want to think about how they could cope with situations differently by tapping into different virtues that nature has given them. So these are kind of more cognitive restructuring, problem solving, rehearsal or coping type approaches that the Epictetus and other Stoics are alluding to. That often happens spontaneously. It's hard to picture a disturbing situation repeatedly without starting to have different ideas about it. And many people will spontaneously figure out different perspectives on a situation and different ways of dealing with it, solving it or coping with it, just giving the opportunity to do so, especially as the anxiety abates. Because when we're anxious, we tend to be locked into a particular perspective, and it tends to be harder for us to be creative and do problem solving. So even just through the natural process of anxiety or other disturbing feelings wearing off, we tend to then free ourselves up to look at a situation and go, actually, do you know what? Maybe there's another way of interpreting this, or maybe it's not as bad as I thought, or maybe there's just a simple solution that I could apply to this situation. People tend to find spontaneously that they solve these problems. Some of the earliest research ever conducted in behaviour therapy discovered that they used to just get people to relax really deeply. Joseph Volper, systematic desensitization therapy, one of the very earliest forms of behaviour therapy. And his account of it was that by training people to relax and lower the heart rate while repeatedly visualizing disturbing events, he was removing the anxiety. But when researchers reviewed the sessions and interviewed his clients, Volper wasn't really talking to them that much. And when people talked to the clients afterwards, they said, well, I was relaxing, but I was also kind of figuring out solutions to my problems and, decatastrophizing, thinking maybe this situation isn't really as catastrophic as I first thought. So there was lots of verbal cognitive stuff going on spontaneously that the therapist didn't even know about. It was just kind of happening in the client's head. So, moral of the story, it's a good idea to talk to your therapy clients. Should I stick with one situation until habituated, or move through a variety of different ones, said David? Or I think he said, it sounds like you're suggesting deal with a range. Deal with one at a time, and once you've dealt with them, move on to other ones. So if we want to go for general resilience, rather than say like someone treating a phobia, so if you have someone who's got a dog phobia, you'd get them to visualize dogs, you'd put them in a room with dogs till anxiety wears off. But if you want to make yourself more generally resilient, you'd pick as many different situations as possible and rehearse like dealing with them, rehearse decatastrophizing them, rehearse viewing them as indifferent, rehearse exposing yourself to them in your imagination until your anxiety abates, so that you'll develop a more general mindset of resilience across the board. So don't pick things that are overwhelming, but pick, if you like, lots of small to medium level challenges, and then just do one after another. Don't stop with the first one. And even brainstorm unrealistic things. Like, I've never jumped out an aeroplane, but I've mentally rehearsed, I don't know, so many different things over the years that I would never have done in reality. I've just tried to imagine situations. Even after having seen a movie, there may be something in it that is kind of scary, and I might picture myself in that situation just to kind of master the feelings and rehearse it in my mind. As general resilience building, I'm not preparing myself necessarily to actually jump out of a plane, but I might use that as a test, if you like, to develop and broaden my psychological resilience skills. I used to get therapists in training to brainstorm situations that we could do. I remember that Russian submarine that sank, like that. Lots of the students picked that as an example, being trapped in a submarine. And another one was abseiling, I think, like kept coming up for some strange reason. Anyway, you can actually draw up lists. We had a list years ago of just all the common examples that people came up with that might not be realistic situations they're actually going to face, but are ones that make them feel anxious if they imagine them. So that those could potentially be used for training. Although generally, if there are real situations that you're facing, then dealing with those should be the priority. But the wider the variety of situations you deal with, the more general your resilience will become, which is good for long-term improvement. In the what next section, that was the only other place initially where there were comments. I added another comment section today, and some of the early comments were, David wrote, could saying it's our judgments that upset us cause self-blaming? That should be like an FAQ because it comes up quite a lot. There's a famous quote in Epictetus, I'm sure a lot of you know it, where he says that someone who's uneducated in philosophy will blame other people, and someone who's partially educated will blame himself, and someone who's completely educated, like a sage, doesn't blame anybody. The Stoics oppose blaming in general. They don't tend to blame other people or get angry with them. I've just been working not long ago on the Stoic practices and concepts of empathy in Marcus Aurelius. I feel this is something that's often overlooked when people are discussing modern Stoicism, and it's odd because it's absolutely pervasive in the meditations of Marcus Aurelius in particular. He's constantly going on about empathy and love and justice and the social virtues, and then somehow people kind of ignore that, or they don't really seem to see it as a theme. But it's in there, and it's integral to Stoicism, and I mean, there are many aspects to it. At one point, Marcus lists 10 different techniques. He just rattles off this big list of 10 different Stoic strategies, and each one of them he goes back to over and over again in the meditations. But one of them is just that the Stoics don't think we should blame people for things that they do unwittingly, and they think everybody fundamentally, they believe, wants to attain wisdom and truth. That might seem odd, but it's part of their theory. I think it's actually quite plausible if you think about it and kind of look at the reasons for saying that. And they follow Socrates in saying that no one is deprived of truth willingly. So when people do bad things or offensive things, the Stoics argued it's because they don't really understand the difference between right and wrong. Again, Marcus says that over and over again in the meditations. I think it's even the first, after book one, which some scholars believe was actually written last, you can see the first passage in book two is kind of the beginning of the meditations proper, and it begins with him saying, if I remember rightly, that's the passage where he says each morning when you get up, rehearse meeting these people that are traitors and slanderers and so on, and remember that they don't know the difference between right and wrong, like they haven't got the moral wisdom or the insight that the Stoics teach. So you should feel sorry for them, rather than being angry with them. So there is this big theme in Stoicism that it should be more like empathy, or that we feel for other people rather than blaming or anger. And in the same way, we shouldn't really feel angry with ourselves or blame ourselves. This is the major theme of two of Seneca's plays about Hercules, incidentally, if you want to go and check those out. Could we lose spontaneity? David also asked. Yeah, that's a trickier one. Maybe in some ways I would say that mindfulness practice and Stoicism can reduce spontaneity, but I think someone else mentions this as well, that on the other hand, if you really want to kill spontaneity and joy in life, then morbid rumination is the way to go. So perseverative worry, morbid depressive rumination, if these practices of Stoicism can help us eliminate that through worry postponement, cognitive distancing, these kind of techniques, then it tends to remove some of the main obstacles to spontaneity. And so at the very least, I'd say we need to take that into account in balancing it out, because when you talk to people, and I think there are already people in the comments section who have said this, many people who practice Stoicism say, yeah, in a sense, mindfulness can make you less spontaneous, but it also restores a lot of spontaneity, and that's often what people report experiencing. Mark talked about how one of the benefits was not wasting time on things beyond our reach, and therefore being more able to enjoy life, which is, again, kind of a little bit like this idea that Stoicism has the potential to remove things that are spoiling our enjoyment of life and spontaneity. Jenny, I like it. I love it, by the way, when people suggest practical techniques, because I'm a technique guy. So I like to see people going, yeah, you could do this. And we get that a lot with online courses, because you are left to your own devices, and no pun intended. But, people go, I set up a wallpaper on my iPhone, and I set up push notifications using an app, and like, you know, using apps that I've never even heard of for journaling and stuff. It's great. Jenny had mentioned setting hourly reminders on her phone to help her remember the distinction between what's up to us and what isn't. So going forward, I think she said she was facing a difficult, sort of challenging few weeks or something, and in preparation for that, setting up these reminders to help like keep cueing her recollection of Stoic principles. That's a great idea. Just one little tip about setting up cues. People don't mention this, by the way, when they're using these, I think they're called wellness apps and stuff. Like in therapy, we might say to people, just like old school, get a post-it note and put it on your computer desk or whatever, like to remind you when you see it to do your exercise or repeat your coping statement or whatever. But that works for a while and then it stops working because of habituation, like the very thing that we were talking about. So everything is useful in one situation and unhelpful in another situation. So being constantly confronted with cats, if you have a cat phobia, is helpful because you get bored with them and your anxiety wears off. But if you want to give yourself a cue to be self-disciplined and practice the technique, habituation can be unhelpful because your little pink post-it note is really eye-catching for the first week, and then after that you just stop noticing it. And the solution to that is really simple. You just change it periodically. So, you know, even if you just change the color of your post-it note or the shape of it or the position of it slightly, you know, every few days or every week, it would continue to catch your attention and act as a cue. You want to avoid it just wearing off. I've not really thought about this as a technical issue with some of the apps, but it may be that people just tune out from the push notifications after a while if they're you know, I don't know if some of them have a way of working around that. You know, they could use a different sound every week or something like that, so they continue to be attention grabbing. Anyway, like, using technology is a great idea. And David talked about going forward, like how you can maintain improvement long term. One way is having the dogmata or the Stoic principles memorized. I like to say, you know, I've not met many people who had quotes. I don't think I've met anybody like that I can think of who has a quote from Aaron Beck tattooed on them. But many people have the Serenity Prayer tattooed, or even an Albert Ellis quote. I don't think. I'm kind of hesitant because I bet there's someone out there who has a quote from Ellis tattooed on them. But loads of people have Stoic quotes. I met a guy serving craft beer the other week in a local bar who rolled up his sleeve and showed me he had a quote from Marcus Aurelius tattooed on him. So one of the advantages of the Stoic literature, I always say, is the beauty of it. The most of the Stoic writings we have today survived because they're beautiful and memorable and valuable as pieces of literature. And that is not a trivial thing, because our ability to memorize some of these sayings and to kind of take them to heart helps us integrate them in our character. You know, like the level of kind of engagement that someone would have to have a tattoo of a quote from Marcus Aurelius, you know, like that would be like the holy grail in cognitive therapy. You know, like we have to settle for people writing things on post-it notes and then forgetting them a week later or whatever. You know, if people really identify with these ideas, then they're more likely to get lasting change out of them. And that's what Stoicism does. It gives people something that's comparable in certain respects to modern cognitive therapy, but has this tremendous power, like rhetorical power actually, that to captivate the imagination and you know, to change people's lives. So I think hopefully that rather dramatic note might be a good place to finish today. There is another housekeeping thing that I better not forget, or I'll get a slap in the wrist, which is those of you who have done the questionnaires for SMRT, please resubmit them via the link that you'll find at the end of the week 4 section. Don't resubmit them if you didn't submit them to begin with, because that's not much help to us. But if you submitted them, then resubmit them now so that Tim LeBon can do the analysis and have a look at how your initial scores compare to your scores 4 weeks later. Or rather, I shouldn't say do them at the end of week 4 to be precise. And I'll send an email out at the end of week 4 again, just to cue everyone and remind everyone to do that. So the link is there at the moment. Complete that questionnaire when you've completed the SMRT, which will be on Saturday, basically, at the end of week 4. So hopefully, that's not bad timing, 45 minutes. Let me just have a quick scan through your comments. And this is where I discover you've been having a completely different conversation about Stalin or whatever. I'm going to go through it in reverse order, so if there are any questions that you want to post, you might be able to squeeze them in now and I'll see them in 30 seconds time. Although if I read it backwards, it's sometimes kind of confusing because of the conversations that you're having between yourselves. I met a guy who had the maxim, know thyself and nothing in excess, in ancient Greek, tattooed on him. There you go, and he introduced you to Stoic Week. How cool is that? Yeah. Yeah, about anger and blaming other people, a Stoic said to think it seemed right to them. Epictetus says that. Do you know what? It's hard attributing things to the Stoics because we have less than 1% of the literature surviving, and I'm always a little bit hesitant because I kind of think, I don't know, Epictetus said this. There's a fairly good chance he took it from some other Stoic that preceded him. The one that really kind of is odd is that Marcus Aurelius quotes Epictetus very frequently. Marcus looks like he had access to Epictetus's discourses. It seems to say that Junius Rusticus, his Stoic tutor, gave him his personal copy, but we only have half of the discourses today. There were 8 books and we only have 4. So for all we know, like, lots of the passages in the meditations that we attribute to Marcus might just be quotes from Epictetus or paraphrases, and many of them may be quotes from Chrysippus or other Stoic authors. We will never know. Aaron says, an issue I continue to work to understand is control versus influence. It's pretty clear that the Stoics get it pretty spot on regarding what is and isn't under your control. Like, it's kind of definitional. They're just saying that everything that's voluntary is up to us. Is it okay if I keep the 2 dogmata of dichotomy of control and the one about judgments in my mind when meditating for the daily exercise? Yeah, I would. I kind of read that passage today in the instructions and I thought maybe it needs to be clarified a bit actually. So I'll go back and have a look at it again. But you could repeat those to yourself when you're doing that practice, or you could just be thinking about those concepts, the like dichotomy, Stoic fork, whatever you want to call it, like some things are up to us, other things are not. I think when you're meditating and doing these practices, it's you don't have to keep saying that to yourself. Mickey's catching a fly. It's kind of so integral to the experience of the meditation anyway. So if I'm sitting repeating a word to myself in meditation, there'll be loads of automatic thoughts that pop through my mind, like, oh look, Mickey's trying to catch fly, and how long I've been doing this stupid exercise for, and stuff like that. And so it's like an object lesson in some of these thoughts are voluntary, like the word that I keep repeating, and then some of them are just not up to me. They're automatic thoughts that are randomly popping into my mind, and it's useful to maintain that distinction. Okay. Donald, do some people become so attached to their anxiety that they don't want to give it up? Yeah. A bit like being stuck in a bad codependent relationship. Yeah, lots of people become really attached to their problems, and there's like secondary gain from it. Yeah, that's a big deal. Like, we often have to help people to think out, very simply we do a cost benefit analysis. What are the pros and cons of the status quo? Like, what are the pros and cons of keeping things the way they are versus what would be the pros and cons of change, and help people think that through and persuade themselves that in the long term it's in their interest to get rid of their anxiety or to change it. Okay, I think... Rosemary, I have a phobia of flying. if I visualise flying, I know it's best to start without having the plane crash. Not sure if I can think of plane without crash, how to tackle that without overwhelm. In therapy, you construct what's called a graduated hierarchy of exposure. So you just have to sit and there's a kind of brainstorming stage where you sit and think, what things make me anxious? And then you put them on a kind of scale, like you put a number to each one, rate them, and then you put them in a table if you like. Usually you do this with a therapist, and then you might start off with the ones that are lower down the scale, assuming the crashing is really anxiety provoking, and then that's too much for you. And maybe again, that you could moderate that by picturing it from a third person perspective, or what happens if you imagine a toy plane crashing or something. I don't feel anything, or it makes me feel a little bit anxious, but it's kind of silly, so it doesn't bother me too much. Well, if you do it repeatedly, it wears off eventually. And then normally what you find is that if you move on to things that are more realistic, if you've habituated or desensitized to other stuff, it will have spread. One of the ways that I explain that is, for example, sometimes people might watch a video of a plane crashing, and they could even put it at the other side of the room from them at a distance, and they might say, okay, that makes me feel a little bit anxious, but it's not as vivid, so it's not as severe. And then if they work on that and overcome their anxiety, they'll usually find that picturing things more realistically and vividly will be less anxiety provoking than it was previously. So, and one good way of explaining that is if somebody has a dog phobia and we take them into therapy, they come to therapy seeking therapy of their own free will, and you get them to visualize a dog, right? And probably they're going to be frightened of most dogs or all big dogs or whatever, and it's not the case that you need to do one session where you do sausage dogs, and then next week you need to do Dalmatians, and then the next week you need to do corgis, and then the next week you do pit bulls, and it's this is going to take ages because we're going to have to go through all the breeds of dogs separately. Obviously, it tends to spread after a while, so you might do big dogs and little dogs or a couple of different breeds, and then the client will tend to find if they've overcome their anxiety for poodles and pit bull terriers, they're probably going to have overcome their anxiety for sausage dogs as well. So there's a natural tendency towards what we call generalization. Okay, so I think that allows me to wrap things up for today. So this is the last webinar. Thanks everybody for putting up with me and coming along and listening to me ramble about CBT and Stoicism. And I'll go off and take Mickey Dog for a much earned walk shortly. She probably wants to get outside. You can contact me via the website. Don't hesitate to email me if you have any more questions. And if there's anything else that you want to add, any other questions, then rather than putting them in the live chat area, which is going to disappear now, I think, it's just gone. Once the video goes up permanently, there'll be a permanent comment section underneath it, and you can post other questions and things in there, and I get notified about those, and I'll go back in and reply to them. So good luck with your final week of SMRT. If you filled out the preliminary questionnaires, don't forget at the end of the week on Saturday to complete those and submit them again, so we've got that data from you. And it's been great reading your questions and comments and all the emails that I've already had from people as well, and incredibly inspiring stuff. I probably don't say this enough, but people send me a lot of emails and Facebook messages and stuff about really personal experiences that they've had doing SMRT, and it's a shame that I don't get to share that. In some ways it's private stuff, but it's very inspiring. And you hear a lot of these stories if you're a therapist, but I love reading about the life-changing benefits that people have taken from this course and from Stoicism in general. I've lost count of how many times people have told me that Stoicism has not only transformed but often saved their life. And that may sound dramatic, but it's something I hear over and over and over again. And in fact, in the previous reports on Stoic, we did ask people to give us feedback that we could publish. And so in some of Tim's previous PDFs of the reports on Stoic Week, I think, or an SMRT. In the SMRT one, actually, you can read things that people have voluntarily put out there about some of the problems they had using Stoicism, but also some of the amazing benefits that they got from it and how they felt it had changed their lives. And even, like young people getting into it, but I've heard from so many people that were in their 60s or 70s, and they were like, for the first time, I feel like something's clicked with me, and why didn't I come across this earlier? So I don't normally have a formula of ending on an inspirational note, but that just kind of popped into my head, and I guess it's a good place to finish there. So know that your peers who are on the course with you, many of them are having these amazing experiences from tapping into Stoic wisdom, and share stuff that you think might be encouraging to other people in the discussion forum. Because the other thing I'll tell you for sure is that one of the most beneficial things for a group of people going through a process like this is to hear from other real people, not people like me, not like therapists and coaches and stuff. Like, we're not real people, like from real people who are in the same position as them and are overcoming obstacles, figuring out solutions to problems and getting benefits. So if you've got a story to tell it to other people, and they'll get a surprising amount of benefit, inspiration and reassurance from that. It's an incredibly helpful thing to do. So let me leave it there. Once again, thanks everybody for coming along, and I look forward to chatting to some of you by email and online again in the future. Take care.